Are you suffering from CMC joint pain right here at the base of the thumb? So that painful joint at the bottom of the thumb. If so, I'm going to show you some techniques that you can do through some exercises and different things at home that you can do to try to reduce your symptoms and improve your strength in your hand. So the first thing we're going to do is going to be tabletop ball rolls. And so you would take a tennis ball. This is not a tennis ball, but you can use a tennis ball or a small ball like this. Got the palm of my hand here. I'm just going to kind of go all around making circles back and forth, just all around the palm, because what we're trying to do is desensitize the area a little bit, make it less sensitive to the exercises and different techniques that we're going to use, as well as trying to increase that blood flow a little bit to the area, just kind of prepare everything for the movements we're going to do. I've had a lot of patients say they have hand pain, whether that's from trigger finger or carpal tunnel, whatever. They'd like to take that ball and do that very same thing that's pretty effective just throughout the day whenever you think about it for maybe a minute or even 30 seconds, whatever you want to do, just to kind of get that movement going in the palm of the hand. Our first movement we're going to do is just going to be some range of motion in the hand and the thumb. So what you're going to do is you're going to prop your elbow up. Now it doesn't have to be exactly perfect just like this, but just for the purposes of the video, just kind of trying to show you an ideal situation. So I'm going to go like this, and now what I'm going to do is right at the knuckle area here, I'm going to bend my fingers down, just like that. So it's a little range of motion, a little tendon gliding, nothing extreme. You're going down as far as you can, right? And the thumb right now is not moving. It's not doing anything. Just kind of got it sitting there. So we're going like this. Then we're going to go now that same movement, and we're going to try to go down and have the fingertips go towards the palms, like kind of rolling down. And you're just going to go as far as you can go. Or you might not be able to go very far at all. You might be able to make a full fist. That's fine. But I still want you to repeat that maybe 10, 12 repetitions for a couple of sets. So you're going to do each one, 10, 12 repetitions. There's that first one, right? Just bend in there at my knuckles. And then I'm going to kind of roll down like I'm trying to come down and almost like hook and have my fingertips touch my palm down there. I'm going to do that one. And then what I'm going to do is work on bringing my thumb across to each one of my fingertips. I'm going to go just like that, all the way across. And ideally, I would start thumb to index first, because that would be easier, because as your thumb tries to come over and touch your little finger, that's called opposition, that's going to get harder, especially if you have a lot of pain through here. If you can't get it to go all the way down and close, don't try to force that. That's fine. Just go as far as you can. But again, each one of these, I'm performing 10, 12 repetitions. So in other words, I would consider one repetition going through touching each finger. There's one repetition. And repeat that 10 to 12 times. And just go all the way through. And you can do that just throughout the day. Again, a great range of motion kind of exercise to start with. Now you're going to take a ball. This is just a soft, kind of a squishy ball here. If you don't have one of these, I've shown this before, you can take a washcloth, just kind of roll it up, ball it up like that, and you can do the same thing with a washcloth. And so the movement that we want in this grasp, kind of position here is just to go in and squeeze like that. How hard am I squeezing? Do I have to squish the ball down and really, bring my fingers close together? No. This can be, in fact, I encourage you initially just to squeeze a little bit, almost like you just feel all the muscles on the palm side of your hand contracting, and maybe you don't even squeeze the ball really hardly at all, just a little bit. So you're just going to barely hold that pressure, and I hold that maybe 2 to 3 seconds and relax. Kind of squeeze in, barely hold that pressure 2 to 3 seconds, and then relax. It's almost like an isometric exercise. I've talked about isometrics before, and that's where there's a muscle contraction without that origin insertion, or there's 2 points where the tendons attach to the bone getting closer together. So if we have a situation where we have really inflamed tissue or an inflamed joint, an isometric is a great place to start before we start a lot of aggressive strengthening. So again, you're just going to take that ball, contract a little bit, and relax. You're going to repeat that for 10 to 12 repetitions, 2 to 3 sets, at least once a day. Now we're going to use TheraPutty. So you can purchase this online. It can be very expensive, or it can be pretty inexpensive, just depending on what you get. There's sets of these where you can get different resistance levels. I always tell patients go with the lightest resistance level first, and they come in a little container here. These are typically antimicrobial, and so it is a resistive putty. This is not the same as the type of putty maybe a child would play with. These, again, it doesn't really dry out, or at least most of the ones that I use do not. We have patients use them. They can go back in the container. And so you can do a lot of different stuff with it. So I've Basically, we can get really fancy with this and go through a bunch of different exercises. However, I just like patients, I tell them just get it, kind of ball it up, and just work it in your hands. You know, pushing in with a thumb, or just push straight down with a thumb. Maybe you're pinching, you take your finger, thumb to tip, pinch together. Maybe we take these two fingers here and the thumb together, pinch down. Just a lot of variety that you can do with this. Sometimes I'll give patients very specific exercises to do with this, but that's not that common. I usually tell them just kind of go through this, you know, just kind of roll it around the hand, squish it around a little bit, because again, it is resistive, and depending on, typically the color will indicate which resistance level it is. So this is a pretty light resistance, and some of these are very, very difficult to even get out of the container to use. So again, that is Theraputty. I do like this, and you just work that just kind of throughout the day, or maybe you're going to take it out and work with it for 5-10 minutes. You kind of set aside that time to do that. So that's a great tool that you can use as well. Another great thing that you can do is use one of these little foam blocks. Now, you can get these online, again, pretty inexpensive. I do have a link on my website, on my Amazon favorites section, ChadGOrthoOT.com, and you can purchase these on there, the ones that I like. So these typically come in like a set of different levels of resistance. So this one's kind of one, it's kind of in the middle. It's not too difficult, but it's not too easy. And this would be something similar with that putty that I had. And you maybe not use both, but you could use either or unless you want both. You can use the putty, say at home. You can put this in your vehicle or take this with you and you know, travel with it, because it's pretty, doesn't take up a lot of space, right? So, and you can do the same thing. So I usually have patients, you know, I'm squeezing down like a tip, or maybe I take my thumb and I mash my thumb into it. I've got it in my palm, just squeezing. So a lot of options with that. And again, instead of doing maybe repetitions or sets with this one, similar to the putty, I would just say maybe just set a timer, or you know, kind of work it. I'm going to work it for 5 or 10 minutes, all in my hand, different directions, pushing in. And you don't have to really struggle with this. If this is too resistive, go with one that's lighter, because we don't want to over irritate the joint. One of the things that we know with arthritic joints is that we need to strengthen the muscles surrounding the joint, right? We want to strengthen all those muscles to try to stabilize for the joint, take some pressure and load off of the joint. So we know that, you know, strengthening an area that has an arthritic joint typically does help with the pain in that area. Now, this exercise that we're going to do is we're going to use this band, and the reason we're using a band instead of a dumbbell with this, now I've shown this multiple times in videos using a dumbbell. The reason we're not going to use a dumbbell with this is because we're going to assume that it's difficult for you to kind of, you know, clasp down here and bring your thumb in to hold onto a dumbbell. So we've got a painful, swollen arthritic joint here, right? So we don't want to over aggravate that. But we do want to do some wrist strengthening, also some additional hand and finger strengthening. So you're going to use one of these bands, and again, they come in sets. There's all different kinds. I have a link on my website, my Amazon favorites section. So I'm just going to put this across my palm like this, right? So I'm not even going to use my thumb for anything right here. I'm going to hold down below it, so you can see how I have this. And what I'm going to do is try to bring my wrist towards me. So I'm bending my wrist towards me, just like that. And I'm going to do maybe 2 to 3 sets of 10 to 12 repetitions of that. And that's wrist flexion. And now we're going to do wrist extension. So I've got the band here on the back of my hand, right? Not doing anything with my thumb. And I'm going to pull my wrist back into extension. You're going to feel that in the back of the wrist, the hand, down in the forearm. To make this harder, you can slide the band down on the fingers. Right? And now, again, we're going to assume that you have arthritis or painful joints, so that may be a little too much. So keeping it right across the widest part of the hand will probably do better as far as your pain. You're just going to pull back just like that. Now getting down to our last few things. One of the things I always recommend to patients, if you can tolerate it, again, you want to make sure that your skin integrity and your ability to feel heat is, you know, intact. And of course, you're using a proper heating product. You can use a heating pad or those paraffin bath machines. I like those. I recommend those to my patients. A lot of those are pretty inexpensive, and although it is a cost, so if you can, you know, use those, or even those small heating pads that, you know, are filled with rice or whatever. You can heat those up in like the microwave and put those on. But again, you want to make sure you're using something that's appropriate, and of course your physician or, you know, healthcare provider thinks it's a good idea to use that as well. One of my favorite things to do when you're having that painful joint here is going to be using one of these braces. This is called a thumb spica brace. So it is going to slide on, and you see how it's fitting. This is not a carpal tunnel brace. It is blocking movement here of my thumb so my thumb does not come down, my thumb does not go out, it stays in place. These are pretty inexpensive. Again, I have a link to one of these on my website, ChadGOrthoOT.com, my Amazon favorite section. And so you're just going to put this on, strap it down, make sure it's not too tight, and you're going to wear that. I have patients a lot of times wear this at nighttime when they sleep. I've suffered with some tendon issues at the base of my thumb and worn this, and this does fantastic. You just wear it at night while you sleep, you know, and so again, it takes some of that pressure off. It keeps you from kind of moving your thumb around all different ways. If you're going to be out throughout the day, doing things outside, maybe you're going to do some gardening, or you got to go to the grocery store and you have to, you know, lift your grocery bags and things, definitely you want to check one of these out. Pretty inexpensive, definitely worth the money. So if you don't have one of these, or let's say that you're in a situation, you're out and about and your thumb really flares up with pain. So let's say that you're on vacation or you're out of town or something and you forgot your brace or you don't have one and you're thinking, man, I've got to do something. So what you can do is you can take tape. Now this is like a Coflex or a Coban. This tape sticks back to itself, so it will just kind of adhere back to itself. You don't have to use this kind of like this kind because it's easy to get back off. You can use the kinesiology tapes. You can buy those at most stores. And so what I like to do is unroll a little bit of this. You're going to take some scissors and you're going to cut a slit right in the center there. Be careful, don't cut yourself like I almost did. You're going to make a slit there. Okay, so now we have this hole. I'm going to put my thumb through that just like this. All right, I'm going to wrap around my wrist. Don't get this too tight because we don't want to end up with a nerve compression issue. I'm just wrapping around, going around and around a few times here, going through my palm. And then what I'm going to do is wrap around my thumb, making a few passes here, just like this, and then just kind of finish it out. Now, I just created my own thumb spica. So that really gives support. That's also great just in general if you kind of have a jammed thumb, or you've irritated your thumb, or sprained thumb, something like that. That works really well to stabilize that area. I can't really move it too much and the pressure feels pretty good. So that's another good tip that you can do. Thanks so much for watching. I hope these tips help to try to alleviate some of that thumb pain that you may be having in order to improve your hand strength and function throughout your daily life. Thanks so much.